welcome everybody. We're going to be waiting a few minutes for additional folks to join us. Okay, we'll be getting started very shortly. Thank you again and welcome. Okay, thank you for joining us, everybody. I think we'll still have some folks jumping on board, but we know we have a lot of ground to cover, so we'd like to get started. I'm Brent Stringfellow, Associate VP of Facilities here at Lehigh, and today I'm happy to be hosting this session for everyone. I'm joined by our Provost and Interim President, Nathan Urban, who will provide a short introduction before turning our conversation over to questions from the audience. Our conversation is focused on undergraduates and their families in preparation for arrival at Lehigh, but is open to the overall Lehigh community. And we welcome everybody who's joining us. In addition to Nathan, we are joined by Rick Hall, Vice President of Student Affairs, David Rubenstein, Executive Director of the Health and Wellness Center at Lehigh, Dr. Sarah Stevens, the Medical Director of the Health and Wellness Center, and Ozzie Breiner, our Director of Housing Services. We will be recording this session. If you have to hop off at any time, you'll be able to access it in the future, and we'll be sharing it via our website. With that, I would like to turn it over to Nathan for a few opening remarks.
Thanks, Brent, and thanks everybody for joining this webinar. So we're very excited to be looking less than a month out to the fall semester. I think that there's many ways in which this fall will be different and more normal than last fall. Some of you may know that I joined Lehigh just a little bit over a year ago, and as Provost, and so I've not yet had the pleasure of seeing a more sort of fully activated and fully engaged in-person campus, and I'm really looking forward to that personally. It will be a more normal life on campus, both academically as well as socially. As we've said in the past, we're planning for in-person classes. The vast majority of classes will be in person. Classrooms will be at full capacity. We're planning for a full range of social activities, sports activities, et cetera, for the fall semester. And really looking forward to being able to provide that and be able to engage in that starting in a few weeks. We are preparing for that in a whole variety of ways. Next week, staff will be back on campus in essentially full numbers to make sure that we have things in place and are ready for when students begin to arrive a few weeks after that. Giving us some time to work out any kinks. And a lot of people have been working remotely for some time, although many of us have been on campus for much of the last 18 months. And so we've got a mix, and we're trying to make sure that we're prepared for when students arrive by bringing people back with some time to prepare. At the same time, we are aware that there's a lot going on across the country with respect to COVID. Certainly, we're watching case counts, we're watching the prevalence of the Delta variant increase. And this is something we will continue to watch and monitor going forward. As one example, just this past week, the Centers for Disease Control as many of you will know, altered their mask guidance, and specifically to recommend masking in indoor spaces and public indoor spaces in areas of the country where there is considerable or spread of COVID is high, considerable or high in their categories. Northampton County is a bit above the threshold for significant or considerable spread. And so we, as of this morning, announced that starting next week, we will have a universal masking policy for all indoor spaces on campus. Outdoors people will continue to be able to be unmasked outdoors. So we'll continue to monitor that situation, and there will be additional guidance as we move forward. The reason that we can have a more normal campus life and campus environment and academic life is because of vaccination. The vaccines are remarkably effective, more effective than I think we could have hoped for a year ago. I'm sort of a neuroscientist by training, and so I have some familiarity and understanding of the biomedical sciences. And the vaccines that have been produced are remarkably effective compared to most other vaccines that have been produced in the history of medicine. So we're really thankful that we can provide this level of protection through vaccination to members of our campus community, and that's absolutely critical. Which is why we have we've implemented a requirement for vaccination for all students who will be on campus, with the provision for exemptions for medical and religious reasons. So we are continuing to collect data of information from students about that vaccination process. The deadline for providing us with that information is Wednesday of next week, on the 4th of August, and we'll be sharing information about the results of that data collection soon thereafter. For students who are receiving exemptions, we have plans for supporting the health and safety of our campus and of them through routine surveillance testing, continued symptomatic testing, contact tracing, symptom tracking, et cetera. So that will be an important part of our planning going forward. It's critical to me that we continue to focus on providing students with an outstanding academic and campus experience going forward. And I think that we are in a good position to be able to deliver a very, very high level of both academic and social campus experience in this fall, given where we are today. So I'm really looking forward to that. We also recognize that many students have been not on campus or even not in the region for some time, and none of our students and none of our faculty and staff have had a normal campus experience for approaching 18 months now. And so we have a number of programs and plans in place to make sure that that return to campus is something that is a positive experience that reconnects people to the Lehigh community and to each other. And we're happy to talk about some of those plans going forward. We also recognize that there will be continuing challenges, whether it's physical health, whether it's mental health, and we have, again, plans in place to address those concerns and those issues going forward over the course of the semester, so that everybody in the Lehigh community can have as positive and as valuable and reinforcing a semester as possible. Thanks, Brent.
Thank you, Nathan. And welcome again to additional participants who may have joined late. I know there's a lot of questions. There's a number we received even prior to the panel, and I know there's quite a few being posted as we talk. So what we're going to try to do is answer as many of those as possible. I do want to set expectations. Obviously, our time's limited, so we may not be able to address all of them, but we do want to address the most critical ones. And just so you know, and it appears a number of people have found it, there is the question and answer box at the bottom of your screen. Please use that in order to ask questions. And we'll be monitoring that throughout the conversation in order to get started. So I think in terms of as we get moving here, we're going to start addressing some of the questions, some of these that came in even prior to today, and then I think there's some impact in terms of as Nathan addressed the mask rules that were announced this morning and how those might impact some of the decisions as well. So, but starting off, I think a lot of the questions are just what the experience of being back on campus would be, and I direct the first one to Rick. Some general questions in terms of, what can students expect? But I think around one of the biggest questions is things like the gym, the fitness center, those types of student activities. What could be expected this semester?
Thanks, Brent. The student experience will be as close to, say, the fall of 2019 student experience as possible. The students will be eating in the dining halls, will be in the libraries, in Taylor Gym, with the primary difference at this point being that we will have masks on indoors. But the outdoor experiences, the programmatic experiences, those will all be offered, and they'll be offered on steroids, beginning with orientation. We're very mindful that students have not had a full experience for the last year and a half, so there will be some programming for the entire student body, a special emphasis on our first year students, and a renewed interest on our returning sophomore students with some specific sophomore reorientation programming to make sure that all of our students are aware of and have access to university resources and programming. I saw one of the questions in the chat was about whether or not students would be able to visit in other residence halls. Yes, students will be able to visit other students in their on-campus residences. And of course, we know that students will be visiting students who reside off campus. So all that the university asks and expects is that we are compliant with the universities and the community's health and safety measures when doing so. But the student experience, and that includes spectator sport experiences for our scholarship athletic teams, club sports will resume, intramural sports will resume, and of course students will receive specific instructions on how to join or participate or cheer on teams, become members in clubs and organizations. There will be a fall expo for student organizational involvement, but there will be a full and robust student experience.
Great, thank you. I think related to that, I was going to reach out to David and Dr. Stevens to talk a little bit about what that student experience might look like at the Health and Wellness Center. And there's a number of questions coming in specifically about some of the steps taken with vaccinated students in terms of whether they'll still be quarantined and those types of steps. But Dr. Stevens, David, could you take us through a little bit about what the Health and Wellness Center is preparing, and then maybe discuss a little bit about expectations for that may be different than what we saw last semester prior to vaccinations?
Yeah, thanks, Brent. Yeah, it's a really exciting time. We are really looking forward to the fall semester and to all of the students coming back this fall. And there are a lot of really exciting developments that have been happening in Johnson Hall. Johnson Hall is home to both our Health and Wellness Center and our University Counseling and Psychological Services. And renovations have been underway over the course of the past year, in which we are opening up an entire new floor in the Health and Wellness Center. And that renovation is going to be complete at the end of this month, and we'll be moving back in to Johnson Hall, which will bring all of our services back into one building. And what's terrific about adding a second new floor is that students are able to, when they're coming to the Health and Wellness Center in Johnson Hall, they're able to be seen on one of two floors. That helps us to see students with COVID-like symptoms on one floor, and to see students with more routine, traditional appointment on another floor. It helps us to mitigate risk in that fashion. As a reminder, our Health and Wellness Center looks pretty much like a primary care ambulatory care clinic. It's made up of 2 physicians, 2 nurse practitioners, 3 nurses, a medical assistant, administrative staff. And so in addition to the COVID-like services that we provide, and those COVID-like services we'll be continuing with testing symptomatic students in our health and wellness center, as well as being able to test close contacts, as well as continuing with surveillance testing for students who are unvaccinated. Aside from that, we'll be continuing with routine medical care, and those are things like wound care, concussion, skin condition, blood work, immunizations, UTIs, STIs, nutrition checks, physical exams, the more traditional routine types of services we'll also be continuing with. Of course, students always have the access to talk to a clinician 24 hours a day, 7 days a week. And of course, we'll be continuing that. And we're really, really excited though about this because it really gives us a brand new floor in the Health and Wellness Center. And it helps us to mitigate risk. It increases access to care because we have another floor. And we're really, really, and it brings our services back in one building. For those of you that may or may not know, our clinics were separated over the course of last year in 2 different locations, in Tremblay and in Johnson. So this brings us all back together. It's good, very, very good from a student access standpoint. As a reminder, we do have a vaccination clinic coming up on August the 17th, which is really important. And of course, there have been lots of students who've been uploading their vaccination card and the vaccination status, which is terrific. And just as a reminder, as Dr. Urban pointed out, August 4th is the deadline. So that's an important date. And to please, please, please upload your vaccination status. Really important for those that are requesting a medical exemption. There's a medical staff committee reviews those medical exemptions and gets back with students in an expeditious manner. The other thing that I do want to mention is our University Counseling and Psychological Services is also offered in, that service is also in Johnson Hall too. And they are made up of licensed psychologists and postdocs and practicum students and interns. And these are the counseling service provides individual therapy, group therapy, consultation to both students and to parents and to staff and to faculty. And we'll continue to provide teletherapy in addition to, of course, in-person counseling as well. So we're very, very excited about that, the fact that we're all going to be coming back into one building. The other part too, of course, students that are coming into the Health and Wellness Center to be seen, the requirement to wear face coverings will continue throughout the year. As a university, I know we'll continue to take a look at what the CDC is recommending, as well as what's happening in our community, and we'll modify or update any face covering requirements across the campus. But within the Health and Wellness Center specifically, yes, face covering will be required. Sarah?
Yes, definitely. As you said, we're very excited about the students coming back. Our team has been on campus over the past year and a half, and I'll tell you, it's been kind of weird to be on a campus without the usual number of students and student activity. So I would say our health center staff is all looking forward to everybody being back. And as David mentioned, with our newly renovated space, we have worked over the past year separating, if you will, the COVID-like symptom patients and evaluations from students with just sort of more routine, non-COVID related care. And really that's all based on, you know, making it a safe place for students to come and get care. So, and I think we're all familiar with that from our own healthcare experiences in communities. So we're excited about that. And as David said, we will continue to have in place protections for students when they come into our space. So there's usually different requirements or recommendations for healthcare settings than there are for other settings. So we stay very much on top of what the CDC, Pennsylvania Department of Health, we have good partnership with local health networks. So we also get their input from their infectious disease specialists, just to make sure we're, you know, in line with that. So we're looking forward to the fall.
Dr. Stevens, could you follow up a little bit about what students might expect related to COVID in terms of surveillance testing, quarantine? What are the policies and procedures we imagine for that this semester?
Yes, so currently students who are fully vaccinated, which is going to be the majority of students, if they are identified as a close contact of somebody with COVID, they will not have to quarantine. But we do close contact testing. And actually, we were even doing that in the spring because the Pennsylvania Department of Health recommended that for people in congregate settings, specifically kind of dorms and that close living. Though interestingly, the CDC just modified that for all close contacts, even if they've been vaccinated. So regardless, we will, and we provide that through the health center, the surveillance testing, the close contact testing. For unvaccinated students, they will be participating in surveillance testing, which initially will be weekly, and that will be similar to last year, but not at Zach. So it's going to be the saliva-based testing. We have that whole process pretty much down pat. Again, that will be a smaller number of students doing the surveillance testing. If unvaccinated students are a close contact, they will need to quarantine. Currently, we have adhered to the 14-day quarantine period of time. Our data last year did show that we had a significant number of students whose positive tests were greater than 10 days after their last close contact. So we stuck with the 14-day quarantine period, just for people's information. We also have the testing in the office, as David mentioned. So if students are symptomatic, and it's important to remember, whether you have been vaccinated or not, it is recommended that anybody who's symptomatic with any of the symptoms on the potential COVID symptom list be tested for COVID. And so we have in-office PCR around 1 hour turnaround. So I'm very happy about that, and we're continuing that for this year.
Okay, thank you. I think kind of turning a little bit over to some of the other questions about what the fall experience will be like. I think going back to the Provost, to Nathan, there's a lot of questions about classes, and in particular, I think there's questions about if the masking requirement affects classes or not. I think also understanding, do we have plans that we would go remote or hybrid? Are we going to be at full capacity? I was wondering if you might be able to address some of those.
Sure, happy to. So we are, the masking requirements will not change the classroom density. And so we're planning on classes at full density. So therefore, we're planning on in-person classes as described, without a requirement or any significant change in terms of classes going virtual or remote or hybrid. If there was a novel variant that rendered vaccines ineffective, I could imagine scenarios, but that is not something that I think is at all likely at this point. We are making all plans for full capacity in-person classes as described. There are a small number of classes that have been described and were described from the beginning as being in-person, a number of graduate classes, but a very small number of undergraduate classes. And the graduate classes, we've had sort of more graduate classes online historically, so that's nothing new. But undergraduate classes, there have been a small number that were created online only, but it's really a handful for very special circumstances. So the vast majority of classes will be in person at full capacity.
Okay, I think that's very useful for everybody to know, and in some ways kind of applies to the follow-up I was going to ask Ozzie about housing and dining, which is kind of the other leg of student experience. And really, I think there's some questions in terms of what's the current process in terms of move-in and if any of the new rules affect that. But then also, what will housing look like? Are we at full capacity? Can people visit one another? And then, and a little bit about the dining halls as well, if you could speak to
Absolutely.
those, Ozzie.
As Nathan said, we're looking forward to a more normal housing experience this year. We can't wait for it. We missed it. And I'm sure those of you who were here last year missed a more normal experience. So yes, our housing is at full capacity. We welcome back our fraternities and sororities this year. So those groups will have the ability to be on campus and experience life in their chapter houses. All of the lounge areas in our residence system, plexiglass is gone. The full seating has been restored. So there will be opportunities to gather, in groups. Of course, with the new mask mandate in common areas of residence facilities, there will be an expectation that masks will be worn. But in your own bedrooms with a roommate, no, there will not be anyone requiring masks within the bedrooms. You mentioned move-in, Brent. Move-in will still be a staggered move-in process. Many of you know this already because you've already registered for a date and a time to move in. We have asked you to sign up for a 3-hour block. First year students beginning on the 16th of August, Monday, through Thursday the 19th, the morning of Thursday the 19th, and upperclassmen beginning in the afternoon of Thursday, August 19th through the 22nd. During that 3-hour time block, we're going to ask that you arrive to Mountaintop campus. You'll check in. We'll make sure your vaccination records are there, or meningitis records are there, and everything that needs to happen. And you'll be given your keys. You'll proceed down to your residence facility via a color-coded map route. And then we're going to ask that you unload your vehicle as quickly as you can within that 3-hour time block, and someone move the vehicle up to parking at Mountaintop campus and take a shuttle back. Last year, we asked that you leave campus after your 3-hour time block. We're not requiring that this year. You can stay as long as you'd like. There's not a minimum number of family members. But of course, while you're moving your son or daughter into their residence facility, you're going to need to be masked until you're in the room, the bedroom that they're occupying. So it will be a little bit different than 2019 move-in, when we had a single day big move-in program with a lot of assistance, but there's still going to be ample opportunity for you to take your time, spend time with your sons and daughters as you leave them here at the university. As far as dining, we're anticipating and preparing for a full dining experience. Our student restaurants and retail locations, for the most part, are going to be all open. There's only 2 retail locations that at this point are not going to open. The Global Cafe in Williams Hall and Lucy's, which is a small cafe in Lindemann Library, will not initially open, and that's simply because of a labor shortage. We are working hard to find folks, but like everywhere across the country, labor is very difficult to find, but we're working hard to rectify that. Everywhere else will be open, and we anticipate it's going to be like a typical dining experience. You'll be able to share meals, you'll be able to serve yourself, you'll be able to choose what you'd like to from our dining lines and sit with your friends in groups and experience meals. While you're choosing your food, masks will be required, but once you're seated and having your meal, of course, you will not need to wear masks during that time. So it's going to be hopefully a lot more like a normal experience. But of course, we're still going to have to be sure that we are abiding by the new mask requirement.
One couple of questions that have cropped up as well are pertaining to the Greek system. And I think there was some that were wondering, and Rick, you may want to join in on this as well, whether, if there's any impact on the Greek system, are we making use of the Greek houses? I think there was some concern based on last year's experience. I don't know if you want to address that at all.
Well, we are using our Greek houses. We have, all of our Greek houses have been assigned. Folks have, assigned bedrooms, and meal plans are beginning up there. And we're anticipating full houses for the upcoming year. Again, Greek houses, fraternities and sororities are Lehigh University residence facilities. So the mask mandate in common areas, we would appreciate you wearing your mask when you're gathering in groups. But other than that, those houses will function as typical fraternity and sorority chapter houses as they've always functioned. Rick, if you want to add anything?
Saying the houses will be up and functioning. There will be, or our traditional large scale Greek recruitment happens at the beginning of spring semester. There is a smaller scale recruitment that'll happen at fall semester, but everything will be up and running. I know there was a question amongst the questions about contracted staff. The national offices and the chapters, they've been working with our risk management and general counsel's office with regard to requirements for staff. And the staff, that's our contracted cleaning staff and dining staff in the houses. And each chapter, they will have already been in contact with those contracted staffs regarding guidelines.
Okay. I think that that addresses a number of those questions. Another one that's coming up in terms of impact, in particular about the masks, and this is kind of moving on from the residence life and dining portion, has to do with performances and I think any sort of group events. Nathan, maybe you want to address that in terms of, I think, artistic performances, I think dance, vocal, and so forth, and how that might work in light of the current rules.
Sure, Brent. Yeah, it's a good question. I mean, we definitely want to have a full repertoire of dance, musical, sort of artistic performances on campus, and we're committed to doing that. Exactly the details of how it is that will work, I think we're trying to grapple with that now with this change in mask guidance and the guidance from the CDC occurring very recently. But we did put some things in place towards the end of last year that allowed for some of those kinds of performances. And with different variations, we had dancers who were masked. We had some musical performances that were performed. Some of them were outside. Some of them were with conditions put in place with physical barriers and things like that allowed them to be done safely. As I said, this guidance change in CDC guidance occurred just a couple of days ago, so we're still working out the details of that. But I'm confident that we'll be able to work out options and arrangements. And currently, because we are not considering, there's not been recommendations about reducing capacity, we are intending for those events to be at full capacity, but to have mask wearing as a requirement for them. Unless that mask situation changes. I mean, just as I think I saw there have been some questions in the mask guidance that came out this week relates to a couple of different things, and why is it applying at Lehigh and some other universities are not adopting it. It is specifically applying to locations where there is substantial transmission, which is this number of 50 cases per 100,000, 50 new cases per 100,000 people over the course of 7 days. Northampton County, where Lehigh is a bit above that, and so that is part of the reason why we might be different from other schools where that number is lower. So that's part of what we're looking at. If that number drops below, then we certainly will look at altering and relaxing the mask guidance.
And just to confirm, I mean, kind of related to the performing arts athletics, we envision a similar type of approach, correct?
Exactly. And certainly no concerns, I mean, at this point about outdoor spectators and outdoor athletics. We're sitting in the Goodman Stadium, watching a football game, unmasked is what we're anticipating and what we're planning for. For athletic events that are occurring indoors, at this point, if conditions, the current sort of masking conditions hold, those would be spectators indoors would be required to wear masks.
Great. We're getting a fair number of questions about vaccinations, and maybe this goes back to the Health and Wellness Center a little bit. Couple of questions, some of them related. I think some of them are, along different lines. There's questions, I think, first of all, if unvaccinated students will be able to participate or whether they'd be excluded from any events on campus. There's also some questions about if boosters become available. Is Lehigh, is that something that students will be able to get through Lehigh? So I was wondering if anybody could address those questions, and maybe we start with the question of participation and the exclusions. And David, do you want to?
Yeah, sure. Yeah. So individuals who've been unvaccinated will be able to participate in really all activities that are happening in the university. From a health and wellness center perspective, unvaccinated people will, of course, want to participate in surveillance testing, and that will be happening weekly as we start the year. And I think that's probably the most significant thing. And that, of course, helps us to keep students safe and keep the campus healthy as we unfold. The other thing and so that's really the most significant difference. The other thing that I would add too is, just like last year, we worked very closely with the Bethlehem Health Bureau, as well as local area health partners like LVHN, for example. And one of the things that we do is, if it turns out that booster shots are things that make a significant difference, and that's what we need to be doing next, then we'll be talking with the Bethlehem Health Bureau and LVHN in terms of having those clinics available on our campus, just like we did last year, in which we partnered with the Bethlehem Health Bureau in terms of having clinics off campus. And of course, in August, we have another clinic on campus. So we have our COVID response team meets almost daily last year. And I expect that will continue through this year as well. And those are the kinds of things we pay close attention to, and pay attention to what the Pennsylvania Department of Health is communicating to us, as well as, of course, the CDC, as well as the Bethlehem Health Bureau, as well as what the epidemiological numbers look like in our community, and then make decisions based on there. So if that turns out that from a booster shot standpoint, that's the efficacious way to go, then we'll set those clinics up that will be available for students. Sarah?
Yes, I would agree with that. And the other thing to keep in mind is right now, COVID vaccines are very available in the community. So unlike several months ago, and when they were first available, it was frustrating for people to get an appointment, to get it scheduled. That's really changed significantly. So again, certainly if booster vaccines are recommended, and right now there's work being done on whether they're going to be indicated, but it hasn't gotten, studies and whatnot, but it hasn't gotten to the point where there is a clear recommendation or indication. But when there is, as David said, we will make sure that we have opportunities for students to be vaccinated.
So a related question, not directly to vaccines, but I think to student health. And David, you touched on this briefly, but obviously there's been a lot of discussion about mental health, I think, for everybody coming out of the pandemic, and in particular with some of the experiences students have gone through. You want to address what mechanisms are in place to provide support and help to students as they come back to Lehigh?
Yeah, sure. Thanks, Brent. So both the University Counseling and Psychological Services, as well as our HAPS office, that's our Health Advancement Prevention Services office, provide many activities across campus for students to remain connected. And from a well-being standpoint, one of the things that we know is that emotional connectedness is very much tied into wellness and well-being. And so, of course, the Counseling Center, as well as the HAPS office, has that in mind in terms of providing opportunities for emotional and social connectedness. And that emotional and social connectedness can happen in a lot of different ways, right? So it can happen through individual counseling. It can happen through the group therapy, in which the Counseling Center has many different groups going on. It can happen through workshops. It can happen through a lot of the specialty workshops that the Counseling Center offers that are really aimed and predicated on bringing students together and connected to each other. The HAPS office works similarly in that the HAPS office is probably one of our most, I think from my perspective, really successful services within the university, because it offers so many different activities for students to come together and be connected. And so that office is also looking at all different activities, many of that which were successful prior to the pandemic, and how to continue with those this upcoming fall, and new programs as well. So it's an exciting time. The good news is, we have a year and a half of this pandemic experience with this, and we know what's challenging. We know what is helpful. And we're really looking forward to the fall and really trying to get back to what we know really works well for students. So I think the long and short of it is, Brent, is emotional connectedness is very much tied into well-being, and both the Counseling Center and the HAPS office is aimed at providing services that provide that emotional and social connectedness through different modalities.
Thank you, David. Kind of in the same line as that social connectedness, I'm going to punt over to Rick right now, because there's been some questions somewhat related. One was just had to do with some of the activities, student group activities. Lehigh After Dark was mentioned specifically. And then related to that, and Rick, I know we've heard you speak on this, is a question of what special steps are being taken for juniors and sophomores, and the fact that, some of these students, it's really going to be some of their initial experience at Lehigh as well. And I think talking about those unique circumstances.
Thanks, Brent. I put a couple links in the chat, including the HAPS office, and that office does house or organize and present a lot of the Lehigh After Dark programming. There are some important dates coming up. One of those dates, August 23rd, is Club Expo. Lehigh, we have about 300 plus clubs and organizations on campus, and a lot of those clubs and organizations saw the membership and involvement dip, of course, over the last year. So we very much anticipate it, and the student members and leaders of those clubs and organizations are very excited about a renewed push for students to be involved on campus in clubs and organizations. And the Club Expo is a great way for that initial introduction to club and organization involvement on campus. That's for our first year students. For our returning students, it'll be a reintroduction. And it will take some effort by the students. The university is going to take make great effort to introduce students to opportunities for involvement. And it will be incumbent upon students to actually take their peers up on being involved. And if there is no club or organization that speaks directly to their interests, then we have systems and staff members in place that will help students create an organization or some sort of activity. It doesn't have to be a standing organization. It can be a one-off event. The HAPS office is great. If students have an idea for a Lehigh After Dark programming, all they have to do is present that idea and we'll work with them. If there's some social function or educational activity even, our offices and student affairs will help students realize those ideas and dreams. As I said earlier, we fully anticipate a very busy socially fall semester, and this is masks or not, it will be social. Our students have been pent up. Our returning students have been pent up. The students that just graduated from high school, they've been pent up, and we know that they're looking for outlets, or they're going to arrive on campus looking for outlets, and they're going to find many of those in both structured and unstructured ways on campus. And I can't stress enough that the staff and the student volunteers, the student employees are in our Griffins. They're coming back August 11th, I believe. They arrive, our residential, our undergraduate student residential staff, they'll be back August 11th. Our orientation leaders, they will be prepared. Our peer health educators prepared and ready, anticipating students who want to be involved in a robust college experience.
And related, there was a question of whether some of the outdoor spaces and so forth will still be available this semester.
So we do have the tent outside of the business college is still there, and that space is available for outdoor programming. And all of our green spaces on campus are available, and a lot of them reservable for programming. I know there'll be like some temporary tents or spaces reserved during orientation out on the front lawn. But over the past year, it gave us an opportunity to sort of scout out spaces on campus that might be used either as standing programming space or, again, one-off programming spaces. And we're open to the uses of all of our spaces on campus for student programming.
Great. So this is a different type of activity there was a question about, and this one might go to Nathan. There's a question about global activities and travel and maybe what expectations. I think, one of the signs of normalcy might be a return to thinking about study abroad or even just being able to travel in the course of research or class. So where do we stand on that?
Sure. Yeah, so we have plans that as of Monday are a new set of relaxed set of travel restrictions and sort of policies that we put in place. So this essentially going forward. So first of all, there are a small number, about 20 or so students who are scheduled to do study abroad this fall. There's a set of programs that we worked to identify that we think have very robust health and safety protocols in parts of the world where we have reasonable confidence that there's high vaccination rates and that there's a comfort level with respect to the pandemic. I would anticipate that if things continue to move in a positive direction, that there will be more of that in the spring. And again, we will be very focused on vetting and understanding programs, both in terms of what kinds of protocols they have in place, what's going on in the region, all those factors are. Office of International Affairs has a lot of experience and expertise in doing that. With respect to not formal study abroad programs, but other opportunities for travel, both domestically and abroad, we have some, we've had historically, at least for the last couple of years, a committee called ITAC, International Travel Advisory Committee, that evaluates all of those programs and the abroad opportunities. And that functions both for faculty staff programs and also for programs that involve students. That's a group that evaluates those programs, has a lot of experience in this domain. It involves people from the academic side, from Office of International Affairs, risk management, University Council's office, so that we can have a sort of full 360 kind of understanding of those programs. And so there will be certainly increasing opportunities for students to travel as part of academic programs, to travel as part of student affairs programming. There's a bit of an approval process that has been put in place for that, just so that we are aware of what's going on and that we can provide guidance about levels of risk. In talking about these committees, I think it also maybe is worth mentioning that we have a group, several of the members of which are part of this call, the COVID response team, which is the group that meets pretty much daily to look at what's happening on campus, what's happening in the world, in the region, that gets requests for changes to policy or for permission to engage in particular programs. And that group will continue to engage throughout. We're meeting all the time now. We'll continue to engage throughout the fall semester to evaluate and revise our guidance and guidelines and any aspects of our operation. So, as I mentioned, both David and Sarah from the Health and Wellness Center on this. Brent is a part of this as it relates to facilities, because a lot of COVID questions have related to how it, spaces and facilities and ventilation and all kinds of things. And so we have expertise in that domain. Again, somebody from our risk management office. And so it's a group that looks at these kinds of questions from a variety of perspectives. Rick is part of it from the student affairs side. And so we look at, at lots and lots of requests and try to make evaluations about safety and how essential and central different activities are to the university's mission to educate and do research.
Thanks, Nathan. Lupin, there's a couple of other vaccination questions that have cropped up, and Rick and Ozzie may want to jump in on this one as well. And it really has to do with questions about the first piece, I think, is really the question of whether there's any disclosure in terms of assignments with roommates, in terms of whether your roommate's vaccinated or unvaccinated. And if there's a notification process and what our approach is to that. The other is there a way that people in general can understand what the vaccination rates are at Lehigh at any given time? And then I guess kind of related from that housing portion is just a question of, are we still going to have isolation housing available if a student is diagnosed with COVID? So. Why don't we start with the vaccinated and unvaccinated? Rick or Ozzie?
Yeah, the assignments were done quite a while ago, and students have until August 4th to actually upload vaccination status. So that was not taken into account during the assignment process. However, most of the students who have received assignments, first-year students, chose each other as roommates and had the opportunity to chat and feel each other out prior to choosing themselves as roommates. So I'm hoping if that was a great concern, that could have been handled during those conversations. We will have isolation and quarantine housing available at Tremblay Park again. We have the entire complex reserved. I'm just hoping we don't need it at all, but it is available should we need it for sure.
Rick, was there anything you wanted to add to that?
That's pretty much it. Ozzie's got our housing info in order.
Okay, great. Now I see there was, in terms of the vaccination question, there was also one about the surveillance testing and whether or not that would be required or available for people who were vaccinated. And just to reiterate, Dr. Stevens addressed this. The surveillance testing is for unvaccinated. I think if there's questions or concerns that students might have about testing in general, probably the best course of action would be to reach out directly to the Health and Wellness Center and address that question. But at this point, there would be no general requirement for anybody who's vaccinated for the surveillance test.
That's
and
correct.
One thing I would just,
go ahead.
One thing I would note about that is that compared to last year, the availability of testing in overall in the community is much higher than it was, both through places like CVS as well as over-the-counter tests, over-the-counter rapid tests. So whereas last fall, getting a test was something of a, or certainly getting large numbers of tests was something of a monumental task, and it could take a week or more at times to get a test result back if you went to a health provider in the community. Right now, testing is widely available. response times are very rapid, and there are many more options available, especially around the rapid testing area.
And the other part of that with the testing and the different vaccination rates and the testing is we will have a dashboard that will be still monitoring the on-campus situation, which will include vaccination rates and any testing information, as we did last year. Obviously, we didn't have the vaccinations for a lot of the year, but that will be available.
Yep. And I just wanted to reiterate once again, for students that have questions about their own specific health status, is to absolutely to reach out to the Health and Wellness Center through the patient portal. We would be happy to help them kind of navigate their way through whatever next steps might be, whether that might be getting tested or coming into the Health and Wellness Center, whatever it might be. So that's the quickest and most efficient way to get a response from the Health and Wellness Center, is to go through the patient portal and, of course, reach out to us.
Another question about vaccination is, we are requiring students to be vaccinated. We have not made a requirement for faculty and staff to be vaccinated. Is there a reason we're doing? Why is that? And is there how do we expect that to unfold?
Yeah, I mean, I can address that. So last year we had more than 1,500 cases identified in students, and a very small number, maybe it's a handful or two of cases identified in faculty and staff. And of the faculty and staff cases, in all but perhaps one case, maybe two, it was clear indication that the transmission occurred off campus, and there was no indication that that was something that was a significant source of infection among the campus population. So that's why we originally made the decision to require testing of students and not of faculty or staff. We are certainly interested in the rates of faculty and staff vaccination. We've provided some information about that. We did a survey of those who responded to the survey. About 63% or so responded to the survey. Something 96% of those who responded indicated that they were fully vaccinated. And so we have some indication that there's a high level of vaccination among our faculty and staff. That said, this is something that we are sort of in the process of reviewing, and based on changing guidance, based on the rise of the Delta variant, we will continue to review this going forward. But that was the rationale. That's the sort of basis for the decision that we originally made.
That kind of relates. I thought this might be a good opportunity to kind of, there's a couple of questions now coming that we've gotten about the mask policy in general, and building on that. And some of those are, I think, a question of, what are the penalties if people aren't wearing masks, and how will that be dealt with?
Yes, so I mean, I can start that. Maybe Rick can jump in.
I was going to say, I think Rick could jump in on that too.
Yeah, I mean, essentially last year, what we did around whether it was mask wearing or it was non-compliance with required surveillance testing, I mean, these were considered as student conduct issues, and so they were brought up as a student conduct case, and we had protocols in place for that. Rick, I don't know if you want to go into any more detail.
And it was I believe, a very fair and swift process. Students were held accountable, and that was one of the concerns of students who were in compliant. They were concerned that students who were visibly out of compliant weren't held accountable, and they absolutely were. We had very low recidivism, meaning students who violated the policy either intentionally or unintentionally did not tend to repeat the behavior once they interacted with our conduct system. But those students, and those reports are received either anonymously or officially, either through a Griffin or through some student or even a faculty or staff member, and any member of the community can report unsafe behavior, and all cases are followed up again immediately and fairly.
is there, in terms of the masking, there was a couple of other questions related that maybe we can talk about or maybe revisit, which is, I guess the question is we talked about this at the beginning of the session, it might be worth addressing again, which is the logic behind the mask, even with knowing that we have a considerable population that is vaccinated, understanding, again, maybe reiterating what that mask rule is addressing based on recent information. So I know, David, do you want to just kind of review that one more time? I think it's a question that keeps coming up.
Yeah. So we're really concerned about the health and wellness of the campus, and the health of the students. And we're well aware of the Delta variant, and we're well aware of the transmissibility and the high transmissibility of this variant. We have students that are coming from all over the country and all over the world as we start the fall. And so really in our thinking is we want to have a successful start to the year and a successful year all the way through. And so for strategies that help us, anything that we can do that can help us to mitigate that risk and to promote the health and wellness of the campus, that makes sense to us. And I think that served us very well last year in trying to do what we could do to promote health and wellness on our campus. And I think from a health and wellness perspective, wearing face covering when we have case rates that are increasing, we have a Delta variant that's increasing, we have an increased transmissibility with this specific variant, even in vaccinated individuals. We're aware of all of those factors. So we want to do, if there's some things that we can do on our campus that reduce that potential transmissibility and help protect ourselves and our fellow students and staff and faculty, we want to be able to do that. Sarah?
I would concur, that the goal really is to have people on campus able to continue with classes as much in person, face to face as possible. And it really requires utilizing a bunch of different tools, really, vaccination, masks. And some of this is going to be fluid is the way I look at it. I see some of the questions say about immunocompromised individuals. And I bring that up just because that's an example of something that is clearly, the information about it is evolving. And I think there's going to be some guidelines that are going to come as a result of ACIP meeting and other things. I think that's coming. So we just have to stay abreast of a lot of these, a lot of the different tools that we have. This is just going to continue to evolve for quite a bit of time.
And the change in guidance from the CDC is in part a result of early data, which has not yet been sort of completely released, that indicates that unlike other variants of COVID, people who are fully vaccinated, if they are infected with the Delta variant, shed substantial amounts of virus. So it has not yet been shown that that translates to communicate disease to other individuals. That's a work in progress, but the fact that you can be vaccinated and show few or no symptoms and still shed a substantial amount of virus is what triggered the CDC's change in guidance. That's their own description, and you can read that on the webpage. And so that means that whereas before you could think about people who were fully vaccinated, if you had 90-95% vaccination rates in a classroom, say, that before it was that people who were unvaccinated, let's say, or immunocompromised people who had a medical condition which prevents them from being vaccinated, could be considered pretty safe because no one in the room was shedding virus. Now that is being called into question, which is why introducing the additional step of adding masks on top of, even in the case of people who are fully vaccinated, largely around protecting people who cannot be vaccinated. And we have an obligation in the state of Pennsylvania to provide accommodations for people for medical and religious reasons. Sincerely held religious beliefs is the phrase. And so we have an obligation to meet the needs of people who cannot be vaccinated because of those reasons. And so this is what we see as the best way to meet that obligation.
I think that's helpful. One set of questions I think are somewhat related. We've talked a lot about kind of the controls and expectations around on-campus behavior, and there's a couple of different questions here, which I think actually are all starting to get at what about areas where students might be that are not direct university controlled. So there's a question about athletics when we're traveling. Do we have, what are our feelings about athletes going to other schools in terms of the safety expectations they might meet there? There's also a question about off-campus living in terms of parties and the social events and how we intend to address that. And then kind of finally, there was a question about who has access to the university. So I think all of these, although they're very distinct, are talking about concerns about when students are in areas or people or the community itself can kind of get into the campus and what we're doing to provide a level of safety in those circumstances.
So I talked about a couple of different parts of that. So, and I should have looked up the current status before getting on this call and didn't. But when last I was aware, and it was probably 2 weeks ago, the NCAA was still planning on having a testing requirement, pretty much the same testing requirement that they had last year for all athletes. That testing requirement included, and I might not get this exactly right, but included day of testing or testing within 24 hours of any competition with another school, as well as testing, I can't remember, it worked out to about 3 tests per week for athletes that were in competition. So that testing requirement, I believe, will continue to be in place as per NCAA rules. Obviously, we can't mandate a testing or a vaccination requirement in other schools. And I know that I'm trying to sort of think through in my head, but the vast majority of schools in the Patriot League have a vaccination requirement similar to ours. And so I expect that student athletes at Patriot League schools and at most of the schools against whom we compete would be in a similar circumstance to us in terms of those vaccination rates. I can ask our athletic director to confirm some of that and make sure that we're up to speed on that. But I'm pretty confident with those statements.
And with regard to, yeah, sure. With regard to the off-campus interactions, as much as 50% of our undergraduate student population lives off campus, within a couple-mile radius of campus. That means we are deeply entrenched in Bethlehem. And we know that our students, they interact in the community at the local retail establishments, our houses, our student housing borders campus. And for those reasons, it's important that students are following not just university protocols, but local health and safety measures. So when they are entering establishments off campus that require masks, they should simply comply. It's as complicated and as simple as that. Simply comply with mask mandates for local establishments. We know that students are going to socialize. We fully anticipate that there are going to be house parties off campus beginning during orientation and early semester. And we simply ask students to be safe and smart. Wear masks when you're indoors. I'm sorry, when you're interacting with students other than the students that are living with you in your residence. Outside, students can be unmasked, just like members of the community can and will be unmasked, but it's imperative that they be safe. Again, the reports that we received last year of students that were not complying with health and safety measures, they came largely, overwhelmingly from other students who were concerned. So our students, they police themselves. I think they do an excellent job of keeping up on what other students are doing and communicating what they would like to see other students do by way of compliance with health and safety measures, because all of the students want the semester to continue with as few restrictions as possible. And currently, the only restriction as we enter into fall semester is that we're asking folks wear masks. There are no restrictions on gathering sizes. You recall that we had those at our off-campus residences last year. There are no restrictions, and that doesn't mean it's a green light to have 200 students at a house party. Again, we still ask students to be smart and be safe, but the only current restriction is that folks wear masks, and it's really important that we're wearing masks at the local establishments surrounding campus in Bethlehem.
Great, thank you. I think that helps. I think the other thing related to this was a question about access. I know last year buildings were pretty highly restricted on campus. Will we still have those same restrictions? Will we be opening up, or certain buildings going to be open and certain closed? How do we know if what the controls will be in terms of people entering Lehigh spaces?
Yeah, it's a good question. We are planning to have more buildings open during what you could think of as kind of normal business hours, maybe 7 in the morning until 5 or 5:30 at night. Exactly which buildings will be open in that way. Other buildings will be open to anyone with a Lehigh ID, but swipe access. And so certainly we will be more open than we have been over the course of the summer. We've already had libraries, for example, are open to anybody. You can just walk in the front door, no need to swipe. So we're moving in that direction. I can't sort of provide the list of which buildings will be in which configuration at this point, but that's something that we are working towards.
Thank you. Another question that crops up again in different forms is, talking about the masks, talking about vaccinations, and this goes back to one of the earliest questions about whether we would shift to online learning. Are there specific metrics that we will watch that will determine whether or not we might switch to a remote model or vice versa? What are the metrics that might have us start to loosen up even more? Are those things that people should be looking out for, or what is the process that the university uses to make those determinations?
Yeah, I can take that. So as I mentioned earlier, the CRT, the COVID response team, is the group that looks at and kinds of tracks where cases are, where we are in terms of level of the cases in the community and on campus. We will continue to do that over the course of the fall semester. And the things that we look at and care a lot about are the numbers of cases of students on campus, the numbers of cases in the region, the hospital and ICU capacity in the region. Last year, there were periods where a hospital capacity here in the Lehigh Valley was pretty low, and that was certainly a concern, and that influenced our decision making around how open or how in person we were. So we will continue to watch those kinds of variables as well as look at guidance. And I think to me the key thing that one of the sort of key differences is this year versus last, which I think gives us the real sense of optimism around how the semester is going to unfold, is that even with the Delta variant and concerns about it, how it is different from previous variants, at this point, the vaccines that are available are incredibly effective at protecting people against serious disease and hospitalization. And so, some of the most recent data, 97% of the people who are hospitalized for COVID are people who are unvaccinated. Of the people who are hospitalized and vaccinated, more than 50% are people who are immunocompromised, above age 75, et cetera. So I think that the concerns about risks in the context of a high rate of vaccination are pretty low. that all being dependent on yet another variant that is better at evading vaccines not becoming available or not appearing. We're not seeing, if you look worldwide, there is no such variant that is out there now that gives me pause. But I can't predict. If I could predict the course of the pandemic, I don't know what I would have done at this point. But I have not and will not be able to do that. I can say with certainty. But nonetheless, I think given what we know now, given the effectiveness of vaccines, given the fact that I anticipate that we will have more than 90% of our campus vaccinated, I'm quite optimistic about our ability to manage through this and with a high degree of in-person activity, especially on the academic side.
Great. Turning away a bit from the vaccination questions and so forth, some general questions have come up. Ozzie, maybe you can answer them. I know there's been a number that have asked just when do the meal plans start?
The meal plan begins on Monday, August 16th at lunch. And I know some people won't be arriving until August 19th or the 20th or the 21st. And they're worried they're going to be missing out on meals. And that's just not the case because our meal plans are basically block plan oriented. So you have a total number of meals to use. Whether you come on Monday the 16th or you come later, your meals are going to be charged based on the amount of meals you use. So it will be available to anyone moving in on the 6th, as early as the 16th at lunch.
Great, good to know. And this does relate a little bit to COVID. So I know Lehigh just finished a new residence hall last year. And part of that residence hall has some a cafe, has fitness studios, some classrooms. That was limited just to students that lived there last year. Is that going to remain that way, or will that be open to the general student populace?
Our brand new residence facility, Singleton Hitch Maida, is kind of divided up where the folks who are living in those buildings have separate entrances to the sleeping areas, but there are also areas that are common, which in those common areas include a fitness center and the Hillside Cafe, and there's conference rooms, study rooms. Those will be available to any student on campus. Again, they would need to be masked at that point if they're using those common areas, but those areas are available to any students on campus.
Great, thanks. There was a question that had come up about, and this is something that's been discussed internally, as we talk about vaccinations on a more kind of year-to-year basis. I know the flu vaccine is one that we encourage for faculty, staff, and students. Is that something, are we going to be offering the flu vaccine this year as part of our health regimen?
Yeah, we're pretty excited about that. I know that 2 years ago we had the most students we ever had in the flu clinic. We partnered with community health partners in offering an on-campus flu clinic that was incredibly successful the prior 2 years before last. And so we're already in discussions with health partners right now. So yes, in terms of having a flu clinic on our campus, it's available for students, staff, and faculty. So yeah, we're very, very excited about that. And we're really wanting to build on, it was just really a wonderful clinic, and we had more students ever in Lehigh's history in terms of students getting vaccinated for the flus. Sarah, you want to add to that?
Yeah, I definitely am excited about having a flu vaccine. It was interesting on campus. It was interesting last year, is if you can remember way back then, when we were all worried, not just us, but nationally and internationally, about the impact that the flu season was going to have given COVID. And interestingly, in the United States and in Pennsylvania, influenza rates last year were incredibly low. And we are not aware of any cases we had on campus, unlike prior years when we've had significant numbers of cases. So I guess in the forefront of our mind is we don't want to forget the importance of vaccination for flu this year. It's very important. So yeah, we're excited about having an on-campus clinic.
So there was a question related to the COVID vaccine clinic that we're offering on the 17th, August 17th. I think the question there was, if a student is planning to be vaccinated at that clinic, do they still need to be tested in the time prior to getting the vaccine?
So I can take that. So we arranged an on-campus vaccination clinic, and a lot of the population we are working to target is students arriving internationally who will not have had a WHO or FDA authorized vaccine, primarily because of not being available to them in their home country. So we wanted to make sure students had the ability after they arrived to readily get the vaccination. And this made it more confident for that, because then we don't need to worry about availability at other local sites. So we know it's available, we know it's here. Students who are domestic should have no problem getting a vaccine where they live. If they do, and again, in Bethlehem area, you can walk into CVS or Walgreens, as everybody's heard me say, they basically greet you at the door and ask you, don't you want your COVID shot? But if a student has, a reason, I mean, maybe they were ill with something and they had to delay getting their vaccine for a period of time. All they need to do is let the health center know and provide us documentation of why they're delayed getting their vaccine. And we will, we can grant a temporary exemption to allow them time to be vaccinated. So that's an option for domestic students, but domestic students should not wait till then, because they will not be fully vaccinated essentially for 6 weeks from the first dose. So again, I would encourage anybody who has access to a vaccine to get that as soon as possible wherever they are. And then we can help if we need to make an exemption for that short period of time to get them through. And if it works out that, the timing of getting it here is what works, we'll work with them on that.
Great, thank you.
And a reminder to people, international may or may not be aware, people in this country probably are aware, but the vaccines are free of charge. There's not a charge to patients. And most insurances, including the student health insurance, covers the cost of testing for symptomatic situations.
Great, good to know. We're starting to approach the close of our time, so I wanted to take the opportunity before we formally end, as I did want to address a final question to Nathan as Provost and Interim President, and just ask him to comment on really what he sees as the most critical issues that we're focusing on as we start this semester.
Yeah, thanks, Brent. I mean, it's hard to narrow the range of critical issues, but I would say the key to so many aspects of this is vaccination. Both the really remarkable effectiveness of the vaccines that have been put in place, a very high safety profile that they have. That's what's really allowed us to have the health and safety conditions that are in place to have a successful semester. And then, what do I mean by successful semester? I mean a semester in which students are engaged deeply academically with their faculty, with each other, in a whole range of both curricular and co-curricular programs. I'm very confident that we'll be able to deliver that. I'm very confident that there will be twists and turns in this process, that there will be things that come up that are unanticipated, and that we will work to deal with them and to be laser focused on providing the best possible academic and living experience for students through this. But the optimism around this semester, I think, is incredibly high, because we are extremely well prepared to deliver the highest quality education, the highest quality experience to students in a way that allows us to keep people safe. So that's sort of where my head is and where my focus is. And again, I think that while there will be changes and modifications, I don't see anything on the horizon that gives me pause that we won't be able to complete a really outstanding semester when so many people are hoping for it and longing for it.
Great. Well, thank you. And I want to take this time as we end today. First of all, I want to thank Nathan, as well as Rick and David, Sarah and Ozzie for participating and providing all the insights and feedback to the questions. And I'd really like to thank everybody for joining us today. We're happy to be able to provide information. We know it's an exciting time. It's a bit of a anxious time, and hopefully we're able to address some of your concerns. We do apologize if we didn't get to your question. I would definitely encourage everyone to go to the Lehigh COVID website. We keep it, it is updated on a daily basis, a lot of information there. And so hopefully you may be able to find some things on that site. We also will be making a recorded version of this webinar available on the site as well. So thank you. Have a great day, and we look forward to seeing you on campus soon.